Hey guys, I trimmed my leg hair for you guys, give you guys a better view here. Anyways, Dr. Stock here with Myofascial Releaser, and today we're going to talk about treating the IT band on the lateral side of the knee here and the lateral hamstrings. This is a very common area for adhesions and pain. One of the reasons that the lateral knee is such a common area for pain is because most people overpronate, and usually that's because we are walking around in shoes that are over supported or over structured with medial support, and so that denies our body from developing the muscles, tendons, and ligaments that we need to maintain our own arch support on the medial foot. So anytime we challenge the biomechanics of our lower extremity, we are going to overpronate, and overpronation causes internal rotation of the tibia. So here I'm going to pronate, and as you can see, there's internal rotation of the tibia, and the IT band is connected to the tibia. I for ilio, T for tibia, iliotibial band, right? So if the tibia is constantly internally rotating, it's pulling on the IT band, it's pulling on the band, and it's going to cause irritation and pressure points right around this area. It can rub on the femur, or the tibia itself can just become really tight, and that's going to cause scar tissue and adhesions to develop all around the IT band distally here, and also proximally, but we're going to focus more on the distal area first. So when you're trying to find your IT band, if you start on the top of your thigh and you roll your finger down, you'll come across this first groove here. This first groove, boom, IT band right there. IT band. So right when you go in, you're going to be between the IT band and the long head of the biceps femoris, or femoris, however you like to pronounce it. So we're going to use the accusphere here. Got the accusphere is this spherical ball on the end of the ellipse. So what we're going to do is we're going to apply a little bit of emollient. Our emollient here is solid at room temperature and melts upon contact, so we're going to apply a little bit in the area just to add some lubrication. And what I like to do is I like to hook the accusphere under the IT band. You're going to find it right there. You're going to hook, and you're just going to floss. Boom. 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 to 20 strokes. 12, 13. Right up there. It'll start to turn a little pink. And if you're currently dealing with mobility issues with your IT band or whatever, you'll feel adhesions right in that area. So foam rolling is good. Foam rolling is more for massaging the vastus lateralis, the quads underneath. You know, when you're rolling on here, you're affecting the muscles, you're loosening up the muscles, but superficially between all the tendons and ligaments in the area, this accusphere here works really well just to get in there deep. It's better than even just manual therapy using your hands. And then if you want to go under the biceps femoris here, the long head of the biceps femoris, that's another great way. So you're going to take the accusphere, so this is the IT band. Now you're going to go under the biceps, hook it, and just floss. And you'll find some adhesions. I can feel there's some gritty scar tissue in there. So I'm a runner, and so I get a lot of adhesions in this area. So I do this once or twice a week, and it helps me stay flexible. I also do foam rolling. I think both of them are important. Just like that. And remember, around the head of the fibula, so the bony area right in here, the neck of the fibula, there's a common peroneal nerve or fibular nerve that wraps around there. So you want to stay around this bony area, stay on the tendons on the thigh, stay away from the neck of the fibula here. If you hit a nerve, you'll feel it. If you feel it, stay away from it. So that's how I use the AccuSphere to floss the IT band and the long head of the biceps femoris on the distal thigh. Now for the actual IT band, I used the actual scanner edge here of the ellipse. So I'm going to apply a little bit more emollient. And I go distal to proximal, about 20 strokes, 3 strokes per second, and I hold the tool 45 degrees this way. So if this was 90, 45 this way, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 15, 16, 17, 18, 19, 20. Now if you guys look at the anatomy of the IT band, most of the collagen, or most of the, what would you call it? Most of the connective tissue of the IT band is actually closer to your glutes, to your butt here. So let me show you. Well, it's kind of hard to see here, but you can see if this was the glute and you go lateral, that's where the IT band begins. So the IT band is actually a continuation of the TFL up here laterally and the glute max. And so a lot of the connective tissue is there. So when I'm treating when I'm working on my IT band, a huge area of focus is right in here. Right in this area. So glutes, hamstrings, vastus lateralis, and we're going to go right here. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Nice and pink. You can hear the grit if you listen carefully. I'll do that once or twice a week, and that'll keep me nice and loose for my trail runs and my track workout. So again, I'm Dr. Stock with Myofascial Releaser. If you have any questions, let us know on our website. You can find our products on Amazon with over 240 5-star reviews, used by the world's top sports medicine specialists. Thanks a lot.